So, good afternoon. My name is Rachel Hillard. I'm a registered nurse and I'm the health science teacher at the Jackson County Area Technical Center. And what I'm going to talk to you tonight about is first aid and CPR. So, if there was an emergency in this room, would you know what to do? If we had one of these three accidents, would you be able to treat it? So, the first question is, who needs to know CPR and why? So, I ask you, have you ever performed first aid? So with that, we think about it. Have you ever cut your finger and then held it while it stopped bleeding? Have you ever placed a Band-Aid on a cut? Have you ever scraped your knee and then washed it? So if you've done any of these things, you have performed first aid. So the answer is every person needs to learn first aid because every person will use it at some point in their life. So life is why. The new first aid and CPR guidelines for the American Heart Association, their new slogan is life is why. We want to learn how to perform first aid and CPR because we want to live. We want our friends and families to live. So with this, heart attacks or cardiac arrest is the leading cause of death in the U.S. 1 in 4 deaths is because of a heart attack. Each year, more than 350,000 lives are lost to heart attacks. And these are considered out of hospital, meaning that they happen in your home or outside of the hospital. When a person has cardiac arrest, their survival depends on receiving first aid and CPR before EMS arrives. We live in very rural areas. It may take EMS 30, 40 minutes to get to your house or your home after you call. So because of that, you need someone there that is trained that can start it before they get there. Almost 90% of out-of-hospital heart attacks die. And with that, if CPR is started with the first few minutes of having a cardiac arrest, your chances of survival doubles and triples. So, do it for someone you love. The people that you are going to perform CPR on most of the time will be a child, a spouse, a parent, a grandparent, or a friend. Because those are the people that you're with when this happens. So if you love your family, you want to be able to treat them. 70% of out-of-hospital cardiac arrest happens in the home, and only 46% of those people receive immediate care. Because either someone is not available or the person available doesn't know what to do. So with this, what should you do? First, you want to take care of yourself. So your diet, like Mr. Henson spoke of earlier, you want low fat, low cholesterol, low sodium diets. You want to moderate sugar and to avoid those refined sugars if possible. You need to exercise at least 30 minutes 3 times a week and do cardiac exercise. You want to speed that heart rate up. The new guidelines for sleep is 8 to 10 hours a day for adults. That was the new guidelines that just come out this last year. So, you need to find an American Heart Association and have a Heart Saver class, which is your first aid and CPR, and learn what to do in case of an emergency. And then you need to know the symptoms of a heart attack, which is chest pain. They describe it as crushing chest pain or heavy weight, pain radiating out the neck and into the jaw. They have back pain between the shoulder blades. This is typically in women, and also gastric pain, which makes them feel like they have heartburn, which is why women don't always go get treated because they think they're just having gas. So know the basics. First thing you want to do is call 911. So when in doubt, call out. Severe airway or blockage is what we call choking. So you're going to perform the Heimlich maneuver. To perform the Heimlich maneuver, first you're going to ask the person if you can treat them. You're going to step behind them, find their belly button, roll your hand up into a fist, grab a hold of it, and pull in and up until the object is released. If you have a person that needs first aid, soap and water is the best thing that you can do. Just wash it, put a bandage on it. If it's bleeding, hold pressure till it stops. The next thing is hands-only CPR. And for that, you're going to sing along. And The song is Another One Bites the Dust. And if you know that song and you can sing it, you're going to do chest compressions to the beat of the song. And as it plays, you're going to take your hand and place it in the center of the chest, put the other one on top, lean over, and you're going to push straight down. And it, oh, that is not. Do we have sound?
Doesn't sound like
No. So, can sound turn up? So, you're going to push it and continue to do compressions until the person either is revived or EMS and advanced care arrives.
Walk slowly down the street, pull it out low. No sound but the sound of speed. She got ready to go.
And that's it.